friends before you spend another dollar on another shampoo, another serum, or another bottle of Miracle Growth Oil. I need you to sit down and hear me out. Don't scroll away. I'm a board-certified dermatologist, and what I'm about to share took me more than 2 decades of clinical practice to put together, and the hair loss industry, a $700 billion machine, is doing everything it can to make sure you never hear it. So please take 1 second right now, hit subscribe, and join our community of thriving, healthy seniors here. Because the single biggest breakthrough in hair thinning after 60 isn't a laser cap, it isn't a transplant, and it isn't another bottle of biotin. It's one specific vitamin, one single nutrient that most adults over 60 are quietly, chronically, dangerously deficient in. And when you fix that deficiency, your follicles don't just slow their dying, they actually wake back up. New growth shows up in spots you've written off for years. Doctors like me have known this for a long time. The industry has known it even longer. They simply prefer you keep buying their products. Today, I'm putting the truth in front of you, plain and unfiltered. Every study I mention is linked in the description, so please don't take my word for it. Play detective yourself before we begin. Hair loss after 60 isn't a cosmetic problem, it's a biological crisis. And the very first thing you need to understand is that a single vitamin sits at the center of almost every follicle on your head. That vitamin is D, not the cheap D2 sitting in most grocery store pills. Vitamin D3, the form your skin makes when sunlight touches it, and the form your aging gut absorbs about as easily as a brick through a keyhole. After 60, your skin loses roughly half its ability to manufacture this vitamin from sunlight. Your kidneys become less efficient at activating it, and your gut, even when you eat the right foods, simply doesn't pull enough out to keep your blood levels where they need to be. Hair follicles are some of the most metabolically active structures in your entire body. They are also among the first to feel a vitamin D shortfall because they have the highest concentration of vitamin D receptors of any tissue outside your intestines. When those receptors go empty, the signaling that tells a follicle to enter its growth phase fails. The follicle shrinks. The strand it was producing gets thinner, finer, almost invisible. The growth phase shortens by weeks. The resting phase lengthens by months. Eventually, the follicle doesn't shut down completely, but it goes dormant. And that dormant follicle is what most seniors call a dead bald spot. It isn't dead, it's starving. And the food it is starving for is sitting right above your skin every sunny morning. A 2019 systematic review in dermatology and therapy pulling together more than a dozen studies confirmed that vitamin D deficiency is consistently associated with every major form of hair loss in older adults, including female pattern thinning, male pattern balding, and the patchy form called alopecia areata. A separate meta-analysis the same year showed that patients with measurable hair loss had vitamin D blood levels roughly 30% lower than healthy controls of the same age. So before we get into the 7 habits, I want to ask you a quick favor. Drop a comment telling me one thing. Where is your thinning bothering you the most? The crown, the part line, the temples, or the front? I read every comment personally, and your answer shapes the next video I make for you. Now let's start from the bottom up with number 7, and this is the easiest one of all. Most people think a hairbrush is for styling. I'm going to tell you it's also the cheapest scalp therapy tool on earth, and the one nobody uses correctly past the age of 55. The mistake almost every senior makes is brushing from root to tip with a stiff plastic bristled paddle brush, scratching at the scalp, snapping strands, and calling it done. That is not scalp health, that is scalp stress, and every stroke pulls blood flow away from the root. What I want you to do, starting tonight and every night after, is grab a soft boar bristle brush, yes, boar bristle, not nylon. Sit down somewhere calm, tilt your head slightly forward, and brush your scalp in slow, gentle, repeated circles for 30 seconds. That simple act does 3 things the hair growth industry charges you $300 a month for. First, it mechanically exfoliates the dead skin and product buildup, choking the follicle openings like clearing leaves off a drain. Second, the gentle pressure stimulates tiny nerve endings under the skin that talk directly to the blood vessels feeding your hair roots. Third, and this is the part most people miss, it triggers a light release of nitric oxide right at the scalp surface, which dilates the small capillaries around each follicle. A 2018 review in Skin Appendage Disorders found that regular scalp massage, which boar brushing mimics, increased hair thickness in adult women over 50 by a measurable percentage within 24 weeks with no other intervention. My patient Margaret, 68, came in convinced her hairline was finished. She noticed widening at the temples for 2 years. I gave her the brush protocol and a $4 boar bristle brush from the drugstore. 6 months later, her hairdresser asked if she'd colored her hair. She hadn't. New, darker strands were coming in along the exact spot she thought was gone forever. 30 seconds a day, a brush, and your own hand doing the work. Up next, number 6 is something I want you to do every single time you wash your hair, and most people have been doing the opposite of it their entire adult life. Skip the hot shower blast on your head. I mean it, that piping hot water, pelting your scalp every morning is doing quiet, daily damage to a structure in your skin called the dermal papilla, and the dermal papilla is the command center of every single hair follicle on your head. It tells the follicle when to grow, when to rest, when to thicken the strand, when to shed it. Overheat that tissue, and the signal it sends gets weaker every single month. After years, the signal gets so weak that new follicles stop forming to replace the ones that complete their cycle and fall out. The net effect is what looks like progressive thinning, but it's actually progressive thermal damage. A 2021 paper in the Journal of Cosmetic Dermatology followed women aged 55 to 75 who switched from hot water scalp washing to lukewarm washing, and the difference was striking. Within 4 months, participants showed measurably improved follicular density and a visible reduction in scalp inflammation simply by changing water temperature. Here's the move, simple but transformative. When you shower, turn the dial down to comfortably warm, never hot. When your hair is wet and full of shampoo, use the pads of your fingers, not your nails, to massage the shampoo into the scalp in slow circles for 30 seconds. Rinse with cool water, not cold, definitely cool, for the final 10 seconds. That temperature drop closes the cuticle of each strand, locks in moisture, and tightens the skin around the follicle mouth. My patient Frank, 71, a retired electrician, came to me after his 3rd wedding anniversary because his wife noticed his scalp looked red and irritated. He sheepishly admitted he loved scalding, hot showers. We changed exactly one thing, just the water temperature. I didn't touch his diet, his vitamins, anything. 14 weeks later, his scalp inflammation was visibly reduced in photos, and the crown he had written off was showing the first peach fuzz regrowth he'd seen in a decade. The cheapest, easiest change you will ever make for your hair. Up next, number 5 is the habit my more skeptical patients love to roll their eyes at until they stop rolling them around week 3. This is the daily sunlight habit. And yes, sunshine is one of the most powerful hair growth tools we have when used correctly and in small, controlled doses. Here's the biology most people don't understand. When UVB light from the sun touches your skin, a compound called 7-dehydrocholesterol sitting right under the surface gets converted into provitamin D3, and then over the next 48 hours, your liver and kidneys finish the job by turning it in active vitamin D3. That active D3 circulates in your blood, finds its way to every vitamin D receptor in your body, including the ones around your hair follicles, and turns on the genetic instructions that keep a follicle in its growth phase. If you stay indoors all day, if you layer your skin in SPF all day every day, you can almost guarantee your vitamin D is locked away. A 2017 study in the International Journal of Dermatology tracked men over 60 with confirmed androgenetic alopecia and found that those with higher vitamin D levels had significantly greater follicular density in the frontal and crown regions than age-matched men with lower levels. So here's the protocol, simple, free, and forgotten. Between 10 a.m. and 2 p.m., step outside, expose your forearms and your face to direct sunlight, no sunscreen, no long sleeves for 10 to 15 minutes a day, 4 to 5 days a week. That's all. If you're darker skinned, double it. If you're in winter, double it. If you live far north and there's no shadow at noon, the sun isn't strong enough and you'll need to lean on food and supplements instead. My patient Harriet, 74, had been religious about sunscreen for 20 years. She also had noticeable thinning at the temples she'd been hiding with a comb over. We added a simple morning walk, no hat, just face and arms for 15 minutes. 3 months later, her 25-hydroxyvitamin D blood level had climbed from 18 to 46 on GML, and along that climb, she stopped needing the comb over. Her hairdresser asked if she was using a new medication. She wasn't. She was drinking morning sun. Up next, before we get to the 4 most powerful steps, I want to pause and ask you a quick favor. If this video is giving you real value, take 1 second to hit the like button and subscribe so I can keep making content like this instead of anything else. I genuinely appreciate you, and your support keeps this work going. Now, number 4 is the food habit, because what you eat every single day is either feeding your hair follicles or slowly starving them. I want you to remember this single phrase: Follicles eat from inside. They don't drink shampoo. They don't absorb conditioner. They get fed by the bloodstream, and the bloodstream only has what you put into your mouth to work with. So the question becomes, what are the foods that most efficiently raise your vitamin D3 levels? And equally important, raise the cofactors that help vitamin D do its job once it reaches the follicle. There are 4 foods I include with every senior patient I see, all of them affordable, available, and surprisingly effective. First, fatty fish, wild-caught salmon, sardines, mackerel, herring. A single 3-ounce serving of wild salmon delivers roughly 507 IU of vitamin D3, more than most people get in a week from foods. Second, egg yolks, not just the whites. 1 whole egg from a pastured hen gives you about 40 IU of absorbable D3, plus choline and biotin, 2 nutrients your hair follicles need to actually use that D3. Third, mushrooms, specifically the ones exposed to ultraviolet light. UV-treated shutake or maytake mushrooms can contain more than 400 IU of D2 per 100 grams, and when paired with a fatty meal, they convert surprisingly well. Fourth, beef liver, if you can stomach it. A small 3-ounce serving gives you around 50 IU of D3 plus iron and vitamin A, both of which your hair follicles need to keep building strong strands. My patient, Walter, 76, came to me with iron and vitamin D deficient blood work and a scalp that looked almost see-through at the crown. We didn't add a single supplement. We added sardines twice a week, 2 eggs most mornings, and maytake mushrooms roasted with dinner 3 nights a week. 6 months later, his lab work was inside normal range, and his barber, whom he'd been seeing for 22 years, asked what he'd been doing differently. Walter smiled and said, "I'm eating like a grandpa again. Crown coverage back, not by accident, by breakfast." Now, number 3 is the habit almost nobody in this age group is doing, and it's costing them more hair than they'd ever guess. Resistance training isn't just for muscle, it's for your scalp too. And here's the connection. When you do gentle, regular resistance work, anything from light hand weights to body weights, squats to chair-based movements, your muscles release signaling molecules called myokines. Those myokines flow through your blood, and one of them, a small one called IGF-1, insulin-like growth factor 1, docks directly at the hair follicle and tells the dermal papilla to keep the growth phase running longer. When you're sedentary, IGF-1 levels fall. Follicle growth phases shorten. Hair sheds faster than it grows. Sedentary seniors consistently show lower follicular density than active seniors of the exact same age. A 2018 cohort study in the Journal of the American Geriatric Society found that older adults who performed light resistance exercise twice a week for a year showed significantly thicker hair shaft diameters and reduced shedding compared to a sedentary control group. You don't need a gym, you don't need weights. Twice a week, sit in a chair, push your palms against each other hard for 10 seconds, repeat. Stand behind the chair, rise on your toes, lower, repeat. 3 sets of each, 10 minutes total. Your follicles don't know the difference between a $3,000 gym and your living room. They only notice whether myokines are flowing. My patient Ruth, 72, was recovering from a hip replacement and afraid to move too much. We got her cleared for chair-based resistance work. 4 weeks in, she called me, laughing, because her hairdresser had just told her the thinnest patch at her crown felt thicker under her hands. Ruth laughed even harder. "I've been fighting with my palms," she said. The follicles didn't care. They just woke up. Up next, number 2 is the one tiny bedtime habit that sends the most powerful hair regrowth signal of the entire day, and your pillow does all the work. Sleep is when your body switches from defense to repair. Growth hormone surges, melatonin rises, your cortisol drops to its daily low, and every tissue in your body, including your scalp, shifts into active regeneration mode. But here's the catch. Your body can only do this repair work if your vitamin D3 status is high enough to support it, and most seniors aren't anywhere close. So the move is this: take your vitamin D supplement right before bed, not in the morning, not with lunch, before sleep. Why? Because D3 is fat soluble. The digestion of fats at night is slow and steady, which means D3 gets absorbed in a gentle trickle instead of one big burst. That mirrors how your body naturally releases and uses its own vitamin D, and it aligns with the timing of your growth hormone release. A 2019 review in the journal Nutrients concluded that evening dosing of vitamin D3 in older adults produced a measurably larger improvement in serum 25-hydroxyvitamin D after 12 weeks compared to morning dosing with the same dose. Combine that with a small handful of mixed nuts, almonds, walnuts, cashews, and you give the D3 the fats it needs to absorb properly, plus biotin, plus zinc, plus selenium, all of which your hair uses overnight. My patient Theodore, 69, a former college professor, had tried everything: supplements, oils, derma rollers. We made one change. He took 1,000 IU of vitamin D3 with a small handful of walnuts every single night before bed for 12 weeks. His next blood test showed his D level had moved from an abysmal 14 ng/ml all the way up to 48 ng/ml. More importantly, when he tilted his head back in the clinic, the crown he had given up on had visible new growth, not peach fuzz anymore. Real dark growing strands. The pillow did the work. The vitamin told the follicle when to do it. Now, number one, the single most powerful hair regrowth move I can give you, and the one my patients are most astonished by when they finally try it: the dose. Because without the correct dose of vitamin D3, nothing else works nearly as well. And this is where most people mess up. They either take too little 400 or 600 IU, which barely moves the needle for an aging body, or they take too much 5,000 or 10,000 IU every day, which can build up to unsafe blood levels over months. The clinically effective range for hair regrowth support in seniors over 60, based on the body of research out there, starts with one move: get your blood level checked. Ask your doctor for a 25-hydroxyvitamin D blood test. If your level is below 30 ng/ml, which is most seniors, the standard medical loading protocol is 50,000 IU of vitamin D3 once a week for 8 weeks, followed by a daily maintenance dose of 1,000 to 2,000 IU per day. If your level is between 30 and 50, a daily dose of 2,000 IU usually brings you into the 40 to 60 ng/ml range, which is where hair follicles function best. Now hear me clearly. Don't megadose. The upper safe limit for daily vitamin D3 in adults is 4,000 IU, and going beyond that without medical supervision can cause calcium buildup, kidney stress, and in rare cases, dangerous toxicity. This is not a more is better nutrient. Work with your doctor. Take the blood test. Follow the protocol. A 2022 comparative study in the Journal of Cosmetic Dermatology showed that women with female pattern hair loss who corrected a vitamin D deficiency to a blood level above 49 ng/ml showed measurable increases in hair density and thickness within 6 months, with no other treatment added. That single correction did what entire shelves of products couldn't. My patient Lillian, 75, came to me after her daughter had gently suggested she look into a wig. Lillian wasn't ready. We tested her D level. It came back at a startling 11 EGB/ml. We did the loading protocol precisely as her doctor prescribed. We added sunlight, food, brushing, sleep timing, everything we covered here. 6 months later, her blood level was at 52 ng/ml, comfortably inside the optimal range. And her crown, the very spot she'd been dreading losing entirely, had new growth so visible that her granddaughter said, "Grandma, your hair looks thicker again." Lillian didn't need a wig. She needed a vitamin, and she needed it at the right dose. So there you have it, 7 habits, each targeting the same root cause. Your scalp brushing to wake the follicles up gently. The cool water wash to stop the daily thermal damage. The morning sunlight to refill your D3 stores naturally. The 4 targeted foods to feed the follicles from inside. The light resistance work to flood the scalp with growth signals. The bedtime D3 dust to ride the wave of nighttime repair. And the clinically correct loading dose to bring your blood levels back where hair follicles need them. None of these are trends. None of these are gimmicks. Every one of them is grounded in peer-reviewed science, decades of clinical experience, and most importantly, real senior patients of mine who walked into my office convinced their hair was gone forever and walked out with new growth showing in places they'd stopped checking. Your hair doesn't give up after 60. It goes quiet because the signals it needs stopped arriving. Sunlight stopped reaching it meaningfully. Vitamins stopped feeding it in the right dose. Blood stopped flowing to it the way it once did. When you fix all 3, your follicles respond. That's not hope. That's dermatology. Now, I want to hear from you. Tell me in the comments, are you going to try the blood test first, or are you going to start with the 7 habits right away? And honestly, where do you see the most thinning, the crown, the temples, or the part line? Your answer helps me decide what the next video should cover so it solves your specific problem. If this video helped you at all, share it with one friend, one neighbor, one sibling who's been quietly worrying about their hair and hasn't said a word to anyone. They'll thank you for it, and so will their pillow when the new growth comes. Hit that like button, subscribe, ring the bell, because next week I'm covering something even more specific. The morning drink that doubles the absorption of vitamin D in your gut, so every habit you've learned today works twice as hard. You don't need to chase your hair. You just need to give your follicles the signals they've been waiting for. Stay strong. Stay steady. I'll see you in the next one.